Our cell therapy is very exciting. It's based upon over 3 decades of work by Suzanne Ildstad and her team.
I named it cell therapy when I was at the University of Pittsburgh. Essentially, at that time, cell therapy had not become what it is now. And it's one of the areas that people are most excited about.
It has a potential for helping thousands of patients, not only for solid organ transplant, but also for autoimmune disorders.
We chose to focus first on scleroderma as our first autoimmune disease indication because it has such a high unmet need and it affects young people that have their entire potential life ahead of them.
This is a devastating disease for patients. Your immune system attacks your body's different cells and it causes scarring not only in the skin, but also in your heart, your lungs, your intestinal tract, your kidneys. So ultimately, your organs start failing.
Autoimmunity is a breakdown of tolerance to your own self, to your own body. And it has been linked actually back to stem cells. So if you take an autoimmune person's stem cells and transplant them back into them, the disease is likely to come back. And the beauty of transplanting healthy cells from healthy donors that don't have autoimmunity is that you can actually reverse that entire process and halt disease progression. It's like transplanting a new immune system that develops in the recipient, and it sees the donor as being part of self. And no drugs can successfully do that. At least none have done that so far.
As a physician, my quest is to be able to improve patients' lives, their quality of life for themselves as well as their loved ones. In order to do that, I've always been interested in doing something innovative, something that hasn't been done before and could really improve lives.
This could potentially benefit millions of people around the world. Through clinical trials, you advance the field because you're answering questions that have not yet been answered.
So we really need to get the word out there to physicians as well as patients that this wonderful possibility exists.
And if you see success, then that makes it better for not only the patient enrolled, but all the other patients that will follow after them.